For centuries, men have debated one question: is it better to have the foreskin or to remove it? This isn't a new conversation. It's been shaped by culture, religion, and tradition for thousands of years. But today, in an era where science and medical research are at our fingertips, the debate often shifts away from what's traditional toward what's healthier, more functional, and right for me. Here at Alpha Vitality, we don't tell you what to do with your body. Instead, we give you the facts, clear, science-backed, and free of myths, so you can make the decision that works for your own health, comfort, and lifestyle. So, in this video, we're going to break it down into 3 key parts: the natural role and functions of the foreskin, the proven benefits of removing it, the risks, downsides, and the situations where surgery might be medically necessary. By the end, you'll have a sharper, more confident understanding of your options. What is the foreskin really? Medically known as the prepuce, the foreskin is a retractable sleeve of skin that covers the head of the penis, the glans. At birth, it's usually fused to the glans, but as a boy grows, it gradually becomes retractable, often fully by adolescence. And it's not just extra skin, it serves several natural purposes. Protection. The foreskin acts as a shield, protecting the sensitive glands from constant friction against clothing and from direct exposure to bacteria or environmental irritants. Moisture and lubrication. The inner surface helps keep the glands moist and maintains a balanced environment, something that can enhance comfort during intimacy. Sensation. Packed with thousands of fine-touch nerve endings, the foreskin plays a significant role in sexual pleasure for many men. Why people remove it? For thousands of years, circumcision, the surgical removal of the foreskin, was primarily cultural or religious. Today, the decision often comes down to medical and hygienic reasons. Let's look at the science-backed advantages. Easier hygiene. Without the foreskin, cleaning is simpler. This helps prevent the buildup of smegma, a harmless but sometimes odorous mix of skin cells and oils that can become a breeding ground for bacteria if not cleaned properly. Lower infection risk. The area under the foreskin can trap moisture and bacteria, raising the risk of inflammation or infections like balanoposthitis. In infants, circumcision has been shown to significantly lower the chance of urinary tract infections in the first year of life. Now, let's talk about the evidence that really gets the medical world's attention. Circumcision isn't just about appearance or tradition. There's solid research showing it can reduce certain health risks. Reduced risk of sexually transmitted infections, STIs. Several large-scale gold standard studies, called randomized controlled trials, were conducted in parts of Africa where STI rates are high. The results were published in top medical journals like The Lancet, and they're hard to ignore. HIV. Men who underwent circumcision had up to a 60% lower risk of acquiring HIV through heterosexual intercourse. HPV. The procedure also significantly reduced the transmission of human papillomavirus, which causes genital warts and is a major risk factor for cervical cancer in women, as well as penile and throat cancers in men. Herpes simplex virus. Type 2. The virus responsible for genital herpes was also less common among circumcised men. Why does this happen? The inner foreskin is thin, non-keratinized, and loaded with immune cells that viruses like HIV target to enter the body. Removing this tissue eliminates a key entry point. But let's be clear. Circumcision reduces risk. It does not eliminate it. It's not a vaccine. Safe sex practices, like using condoms, remain the most effective protection against STIs. Lower risk of penile cancer. Penile cancer is rare in developed countries, but the risk factors include chronic inflammation, poor hygiene, and HPV infection. Since circumcision improves hygiene and lowers HPV rates, it's linked to a lower lifetime risk of this cancer. The downsides. You must consider no surgery is without risks. While complications are rare when performed by trained professionals in sterile environments, they can happen. Pain during and after the procedure. Bleeding and infection at the incision site. Cosmetic dissatisfaction, too much or too little skin removed. Altered sensation, removing nerve-rich tissue can change sexual sensation. Some men notice little difference, others report reduced sensitivity. Loss of natural functions. Without the foreskin, the glans is always exposed, which can lead to slight thickening of the skin, keratinization, over time. For many men, the decision to remove or keep the foreskin is personal, a balance between tradition, health, and comfort. But there are times when it's not about choice, it's about medical necessity. 1. Phimosis, when the foreskin won't retract. Phimosis is a condition where the foreskin is too tight to pull back over the head of the penis. In mild cases, it can be managed with creams or stretching, but in severe cases, it can cause pain during erections or intercourse, difficulty cleaning properly, frequent infections. If it's causing recurring problems, circumcision is often the permanent solution. 2. Paraphimosis, a true emergency. This is when the foreskin is pulled back and gets stuck behind the glans, acting like a tight ring. It can cut off blood flow to the penis, and if not treated immediately, it can cause permanent damage. In many cases, surgery is the safest fix. 3. Chronic or recurrent infections. Some men experience repeated inflammation of the glans and foreskin, balanoposthitis, that doesn't improve with better hygiene or medication. Circumcision often ends the cycle for good. 4. Cancer risk reduction in high-risk cases. While penile cancer is rare, certain men with chronic inflammation, high HPV infection rates, or poor local hygiene may be advised by their doctors to consider surgery as a preventive measure. The final decision. If you have no medical issues, the choice is personal. For parents, it may be about cultural or preventative beliefs. For adults, it's about weighing proven benefits against possible downsides and deciding what aligns best with your health goals and lifestyle. What matters most is that you make an informed decision, not one based on myths, pressure, or internet rumors. And the only way to do that is to talk to a qualified urologist, get examined, and discuss your specific situation. The Alpha Vitality Takeaway. Your foreskin is neither good nor bad. It's about what's right for your body. If you're experiencing pain, discomfort, or repeated infections, don't ignore it. Seek medical advice now, not later. And if you care about your sexual health, performance, and overall well-being, you're in the right place. This is Alpha Vitality, where men get real, stigma-free health advice backed by science. If this video gave you clarity, hit that like button. Share it with a friend who's been wondering the same question, and subscribe now, because your health, confidence, and performance deserve nothing less than the truth.